Hey guys, my name is Michelle. I'm going to be covering the surface anatomy for the hip and gluteal regions. I'm only going to go over anatomy that you can easily see or palpate, since we have to keep these videos PG. In the next video, I'll go over the portions that we don't cover here. So the first thing we're going to go over is the iliac crest. So you're going to go ahead and put your hands on either side of your hips, and you're going to palpate towards the midline. So that kind of curved structure that you feel on those lateral ends, that's going to be your iliac crest. You're going to take your fingertips and move about 2 centimeters inferiorly. So this anterior portion is going to be the anterior superior iliac spine. If we move posteriorly in the same position that we originally started in, we're going to palpate posteriorly. People call this the back dimples. It's not really an anatomical term, but this is about midway between the gluteus maximus muscle and this bone, along with the sacrum, is going to form the SI joint, which is the sacroiliac joint. It's often the site of low back pain, so there's multiple tests you can do with your doctor or physical therapist, your chiropractor, to determine if this is where your low back pain is stemming from. Next, we're going to go over the greater trochanter of the femur. So we're going to palpate the lateral aspect of the femur or thigh. We're going to move superiorly, and you'll feel a sort of notch there on the ends. An easier way to feel this is if you first abduct the thigh at the hip. So while you're palpating, you're going to then adduct the thigh, and you can feel that notch a little more prominently. Next, we're going to go over the inguinal ligament. So this is a ligament that runs from the pubic tubercle, that's about here, to the anterior superior iliac spine. And the importance of this ligament is you can actually palpate the femoral artery from here. So if for whatever reason you can't use the first option, which is your jugular or your brachial, your wrist, you can use this portion. The last thing we're going to cover is the ischiotuberosity. So the ischiotuberosity is the portion of the coxal bone. It bears weight when we're sitting. The gluteus maximus normally covers it when we stand, but it exposes this portion when we sit. So we're going to trace the thigh up proximally on the posterior side, and then we're going to feel a bony structure at the base of the ischium. The easiest way to actually palpate this is to sit down on your hands with your palms up, and you're going to make sure that your fingertips are at the level of the medial aspect of the gluteus maximus, as if we were standing. Next, we're going to rock our body side to side, and that's an easier way to feel that bony structure.